May we then move on to the business plan for 2015-16. I'm going to invite Karen to introduce that for us, please.
Yes, thank you, Malcolm. The business plan this year reflects a lot of work that we have been doing. Clearly, the business plan is an important document. It sets out the work that we really need to do this year to take forward not only the delivery of our mandate, but also the critical change work that we need to start initiating and that is presaged in the 5-year forward view to ensure that the mandate and outcomes can be delivered in years to come in a financially sustainable basis. So the business plan this year, we have tried to respond to lots of comments that we've received through the year to focus down onto 10 key priorities that we, rather than trying to cover everything that we do, but focusing on 10 key priorities where we need to make a significant step change and difference for during the course of this year. And those priorities cover a number of themes that will endure, even though our priorities this year may change from the priorities that we choose to take forward next year. The themes that we are working within are likely to endure. And those are in transforming care for patients, and particularly this year we're focusing on making the step change in cancer and mental health, learning disabilities and preventing diabetes. In designing services around patients and transforming those services. We've also have a big priority associated with achieving financial sustainability through making whole system change, obviously working very closely with all of our partners in the system. And underpinning all of that, we need to put some significant enablers in place to drive and support all the change across the system. So we had a discussion with board members yesterday, and we are in the process of capturing and finalising the business plan, and we would like to ask the board today to delegate approval to Malcolm, you and to Simon for finalising that so that it can be published tomorrow. And the other thing I should say is we have been doing a lot of work as well around our budget allocations to ensure that our budgets are aligned with and support all of our core priorities. That's all I would say.
Well, thank you very much, Karen. Let me invite comments from members of the board. Kieran.
Karen, thank you for the swan-like delivery of that. I think we all know there was a lot more paddling underneath. Significant enablers, if I can just pick you up on the word. If we're going to make these changes, one of the 10 priorities is this kind of whole system change, which is slightly a large priority. We're going to have to do things in a very different way. It's got to be much more data-based. Do we have the analytical capability? Will we generate, the right insights in the right time? What about culture, behaviours, collaboration, partnerships? Because we're not always good at that either. So the how as well as the what.
Absolutely, that's fundamental. And one of those pieces of work under the key enablers is the work that we're doing within our own organisation to improve our own capabilities. And there are definitely some capabilities that we do need to improve in terms of data and information, so that we can use the right strategic insight to create the best strategies for the future. But not only the capabilities, as you say, it's critical that we start to change the way that we operate inside our organisation and with our partners. So working really closely with partners as a routine is fundamental. Working closely with patient groups and citizen groups so that we properly understand what they need to, what they want to achieve out of all of the change that we are doing. It's another cultural change for us to continue to make that journey. And perhaps most importantly, working in a way which facilitates and enables local change with less focus on performance management associated with targets, although performance management is absolutely critical to ensure that we continue to deliver our service targets as well.
But are you confident we're putting enough weight behind it? If we look at NHS Citizen yesterday, there was one quote which was fantastic, which was, "This feels like real consultation, not like so often in the past." So you can either see that as brilliantly encouraging, or you can say, well, are we confident that as we go out and about trying to make the change happen, we will truly engage individuals, patient organisations, clinicians, partners? Because that's a skill. It's not just something you say. Are we going to be able to develop that and deliver that?
Well, it's absolutely something that we are working on. Tim has set up with Victor chairing a task and finish group. Specifically to ensure that across the organisation we are, in all of our business areas, working differently in order to do that. I, like you, don't underestimate the scale of the challenge in people being able to make that change. That said, there are lots of good areas where we are already doing that, so we need to work on the good practice that already exists. We know, for example, there are many CCGs as well who do that as a matter of course, and we need to learn from their good practice as well as build it into our own processes.
David.
Just picking up on, excuse me, on Kieran's theme, it's good to see the alignment between the financial dynamic and the business plan objectives. I guess the other key side to this is, have we got the appropriate people, leadership, talent to be able to focus on what are critical priorities for patients, and are we sure that that we can mobilise them quickly enough?
So there's a piece of work that we have been doing, which is again something that we'll be discussing later on today, about leadership and improvement. Ed has been chairing a piece of work around that, which is precisely to look at how we can ensure that the capability that we have in the system, and particularly that we nationally fund and support through NHS England, is directed and aligned with the work that we need to do for the 5-year forward view, and trying to connect that more explicitly with the systems, the local systems that are responsible for making those changes happen, but connect it very clearly with the strategic direction of the 5-year forward view. So yes, that's a piece of the work. That's one of our themes and priorities that we'll need to take forward this year.
Moira.
Thanks, Malcolm. Karen, the word commissioning actually appears on this slide only once. So the role that NHS England is playing in these is often a leadership one rather than a straightforward commissioning one, but it's reliant on lots of partners. How much consultation, how confident are you that the partners are aligned with the priorities here? Well,
we've obviously talked to our partners about our emerging business plan, and we have seen their emerging business plans as well. Clearly, we each as organisations have a different focus on the work that needs to be done, but the core of this is that what we're building our business plan around is what we see as strategically essential to support the 5-year forward view, and each of those organisations are doing exactly the same. So I'm very confident that not only collectively but also individually around the individual priorities we are working extremely closely. Undoubtedly though, this is something that we need to spend even more time on and make just the normal way of doing our business, in ensuring that everything that we do collectively, and I think we're putting a lot of energy into trying to do that now.
Margaret.
The Foundations for Change include an enormous emphasis on digital improvement, and my question is, can we assume that the the digital agenda includes a real focus on understanding and preparing for the best that we can achieve in terms of security. I mean, in a way, this, I suppose, is a question that sits between you and Tim, but it requires a massive oversight capability from our perspective.
Well, I mean, I'll perhaps let Tim answer that one. As far as NHS England is concerned, absolutely, while we haven't particularly majored on security in our priorities, it is core to our business as usual. It is absolutely fundamental to everything that we do, and we are continually improving everything that we're doing around data security and particularly cyber security, given the risk that we all know is there. But Tim, perhaps you want to talk about the NHS.
I mean, we're, as we will discuss a bit later on in one aspect, we are wanting to very urgently make the digital offer not just to our clinical colleagues but also to patients and citizens, and the quid pro quo is that we can demonstrate that we have set, frankly, a new standard in the way in which we will do our level best, be at the cutting edge of the of science in delivering secure data sharing environments. There are lots of real challenges there, many of which have never been, in a way, developed anywhere. You know, how do you handle identity assurance at a scale in this kind of context? That's never really been developed before. So we've got lots of questions we haven't answered, but just to reassure you, this is a fundamentally important part of, in a way, delivering the 5-year forward view, because in my view, without the underlying digital architecture existing, we can't deliver the kind of integration, the communal opportunities that we want to provide.
Thank you. No. Karen, in one sense, this business plan is of course now designed primarily as a means of communication with our people within the NHS. In subsequent incarnations of this, it also becomes a series of pledges that we are going to make to patients, public and citizenship more generally. Will we eventually, in subsequent incarnations, become more specific about what outcomes we're going to deliver?
Yes, I think that's really important. Clearly, some of the work that we've outlined in the business plan is very clear and well established, and some is absolutely new and fresh thinking based on the 5-year forward view. But in both of those areas, we need to connect it with the outcomes that we're trying to achieve and deliver for patients. That's always tricky in that we want to make it very real and visible for patients and for our staff as to what will be the difference. We want to do that in a way which sets a stretching agenda and targets, and equally we don't want to get into more target and performance management, I guess, around the business plan, but be clear where we're trying to get to. So yes, absolutely, we'll be aiming to try to link this to target outcomes.
Thank you.
Well, thank you, Karen. I think that the board can reflect on, first of all, the fact that from last year's business plan with 31 priorities, we've come down to 10. That secondly, the business plan that we will sign off, I think is the product of quite a lot of hard work and development, which involves the non-executive directors as well as the executive directors. And there's not a culture clash, there's a culture blend from those with, shall we say, extensive experience in the NHS and those who have extensive experience in other environments as to what a business plan might look like. I hope that we've captured the best of both worlds, but certainly as a board, our emphasis, I think, is on simplicity, clarity, an ability to communicate to those whom we employ and across the NHS more generally what it is that we regard as absolutely top of the list. An ability to assure the Department of Health that we're in a position to satisfy the objectives of the mandate, and an ability to ensure the board at large that we know what's happening, what we're committed to, how we measure it, and how we hold the executive to account. So I think that the business plan is on track. I don't think these things are ever the perfect finished article. but it's been a very valuable experience for us all. On that note, may I invite the board to approve in principle the business plan and to authorise the Chief Executive and me to do the final editing and to sign off the fully polished version. I think I have the assent of the board. Thank you very much.